Good morning, welcome to our live talk program. This is Lloyd Grubb here, your host on Revive Reform Radio, doing our live talk program covering natural health on your Wednesday morning rise and shine. And this morning here, we're looking at the topic homeopathic remedies and health news. So just looking at some health news and something in the news about homeopathic remedies and some other things I'll be looking at this morning here. So welcome again to our live talk program. Hopefully you had a blessed night rest and you're ready to take on today, this day that the Lord has given you to be able to have life and liberty. Let us pray. Our Father, who art in heaven, we thank thee again for the blessings of your word. We thank you, dear Lord, for the blessings, your Lord, of knowing thee, the only true God. I pray, dear Father, that you may be with us, dear Father, as we look at these things, and may you continue to guide us into the best way to take care of our bodies and be in good health. Thank you again for your blessings for Christ's sake. Amen. So we're looking at three articles I'm going to share with you here this morning on homeopathic remedies is the main article I'll be sharing, but I'll share two other articles before I get into that. I just want to talk about what's going on in the health world today and what's happening. And so I start off by just sharing this two articles, and then I'll go into my talk. So the first one I'm going to be sharing here is on the NIH lifts limits on making deadly new viruses in the lab. Now, I'm sharing this because I want you to be aware of what's happening, or what's the National Institute of Health and other groups that are investigating, studying, looking at what's going on, that there's an expectation that soon we'll be experiencing, sometime probably in the next 10 years or so, between now and the next 10 years, it could be any time it could strike, a pandemic or epidemic of some type of virus, flu, something, and along that lines. And so what I'm sharing this for, because I want you to keep abreast of this idea and know that if this breaks out soon, or even a few years from now, that it is something that they're looking at and taking serious. And so why is this important to you? That you also consider these things and take your health serious and take your understanding of natural remedies to deal with some of these things that are coming upon the earth. So I'm going to share this article here with you. This is from NIH, and it lists limits on making deadly new viruses in the lab. This is written again by Maggie Fox over there at NBC News. It says the National Institute of Health has lifted a moratorium on making flu and other viruses more deadly and easier to spread, saying the research is needed to prepare the world better for killer pandemics. So basically, they're concerned with the spreading of these diseases, and they want to be able to understand how these various different bacterial viruses spread, so that they can be more prepared. The experiment has been paused while NIH arguments that the research could be dangerous and even foolhardy. It's taken 3 years to decide they are worth doing. We have a responsibility to ensure that research with infectious agents is conducted responsibly, and that consider the potential biosafety and biosecurity risk associated with such research, says the NIH director, Dr. Francis Collins. Now we have a policy that is much more transparent and clear. The pause affected fewer than 2,000 experiments on 3 types of virus: influenza, the MERS, which is the Middle East Respiratory Syndrome virus, and severe acute respiratory syndrome, or SARS. So influenza, MERS, and SARS are the diseases that they want to be able to understand how they mutate. Influenza viruses especially mutate constantly. Such mutation make them more lethal. Some make them spread more easily, and some can actually make the virus less harmful. So-called gain of function research aim to find out what mutations it would take to make, say, a H7N9 bird flu virus transmit more easily from one person to another. So in other words, what is the the mutation that is taking place, that would make it be more transmissible. So if you, I guess the reasoning there is that if they understand what is the thing that is causing the mutation within its structure, then it's a possibility now for them to be able to protect against that, so that if a person has the virus, and I guess they have a certain coding in their system, a certain type of thing that blocks the easily transmittable portion of the disease, or the attribute of the virus, then they will be able to probably not stop it in the sense of spreading, but stop it from easily spreading, so you could prevent a pandemic. I guess this is what I'm understanding their line of reasoning is. So public health experts can then watch for those mutations to show up in time to raise the alarm about potential new pandemic strain of flu, and there could be more time to make a vaccine to protect against it. For instance, in 2014, Yoshihiro Kawahoka of the University of Wisconsin made a mutant version of the 1918 Spanish flu virus that killed tens of millions of people. His team found that version of this strain are still circulating in wild birds, and it would not take much natural genetic mutation to turn them back into forms that could infect people once more. So if you remember, one of the largest recent history, I guess, recorded history, was the 1918 Spanish flu. As I say here, they killed tens of millions of people, and that strain is still existent in bird. And so they're saying wild birds. So they're saying, see those wild bird outside, they could easily transmit the disease. Just the disease could start mutating, and next you have it in human beings, and it starts spreading, and now we have a repeat of the 1918 Spanish flu. So those are the things that they're looking at, and they're saying this is so possible, but what makes this happen? What would cause it to mutate like that? That's what they are questioning. Should they research that? Because by researching, you're exposing the staff to it. Sorry here. So here it continue here. So no lab is 100% secure. There were fears about the accidental escape of such a killer virus. Plus, scientists published their findings, so there was a worry that someone might use that information to deliberately engineer a mutant viral weapon. So 21 experts were halted in 2014 while various boards and bodies of experts studied the question. So as it noted here, and it's important to you to know, the other side of the coin, not just talking about it, because again, I'm reading this to you here because I want you to know that these are possibilities. And so if they're looking at the possibilities, you also must look at this possibility and prepare yourself for this possibility or inevitability. But yet, that part there, I think, is important to understand that when they say, for instance, they come out with a finding, they'll publish a finding. Such and such scientists in such and such university figure this thing out. But then somebody can take that information and make it become a weapon. Because, again, if you spread a virus that is highly mutating, and is also very easy to be passed on from one person to the next, well, that virus can become really a weapon, because now you have a virus spreading in a country that can't stop it, don't have any natural defense against it, and it start killing a whole bunch of people. You could have it, basically it's a weapon. You're weaponizing basically viruses and bacteria. And so here, this is what the worry is about. So this is why they put a moratorium, and now they're considering lifting it. So 21 experiments were halted in 2014, and they were halted because of this issue here of it becoming even a virus. Various boards and body of experts studied the question. Several embarrassing lab accidents worsened the fate of the critics. So the critics lost faith because vials of live smallpox virus were found in a freezer on the NIH campus in 2014. And the Center of Disease Control and Prevention accidentally shipped out a live anthrax that same year. So, and if you remember, but in 2014, I remember this was some of the big headline news that by accident the CDC had shipped out to a lab. I think I can't remember if it was in Ohio or somewhere. They shipped a lab, and I think it was more than once it had happened. If I remember clearly, it happened multiple times, but back to back, they had this situation where they shipped out a live virus. So the virus was supposed to be dead, and instead of it was alive. So it was basically highly communicable. It could have infected workers in the lab. And since, as they stated before, that no lab is 100% safe, well, you could easily have a mess up with somebody thinking, well, they handle it without the proper precautions because they think it's a dead virus. And so this happened in 2014, and then again there was an accident that happened there with on the National Institute of Health in 2014 also. And so they decide, well, wait a minute, we're playing around with some very highly communicable diseases, and they're easily to infect others. So we need to shut it down. So now they've decided that, I think they're good now. So since then, 10 experiments were allowed to go forward on a case-by-case basis, and others have probably become outdated. Now NIH has decided on how to do the work safely. I was hoping this might find its way out a little sooner. Now we are there, says Colin, and as he told reporters. For at least 2 decades, infectious disease experts have been urging U.S. government to do more to keep the country prepared for outbreaks of diseases, including new flu strains, SARS and MERS. Influenza specialists say the chances of a new flu pandemic is 100%. Flu mutates constantly, and a major new strain emerges about every 20 years. The last one was the H1N1 swine flu in 2009, which was fairly mild but worse epidemic are probable. Yet, panels of experts also find U.S. is poorly prepared. The latest report on Tuesday finds that many U.S. states have only the barest of preparation in place. The report from the Trust for America's Health Foundation, federal and state efforts alike to prepare for disasters such as pandemics, severe weather, and attacks have slid backward, with federal funding cut in half since 2012. So, as you know, and as you're being familiar with or been watching your news, you know that the funding cuts have been continuous. And because these funding cuts are going on, then it's important for you to know, even though it's going to be more difficult because everything done in mass is always cheaper and easier. But as they're doing funding cuts, you need to be able to always get together your little remedies, your methodology in place for when things like this going on. So if you start to hear about an outbreak of flu, if you hear the flu is more severe than a normal times, then you need to start making a preparation. And so keep that in mind. I'm going to get back there. Let me just close out this article here. The accomplishment achieved to improve public health and preparedness for all hazard is being undermined due to severe budget cuts and lack of prioritization, the reports read. Instead, the nation is in a continued state of reacting inefficiently with a series of federal emergency supplemental funding package each time a disaster strikes. The country does not invest enough to maintain strong basic core capabilities for health security readiness, and there is often a need for additional funds, it's added. So this here is important for you to consider now. That was the end of that article. So consider for yourself what you will do in cases things happen, because as you've seen in the last, especially probably 15 years, the disasters that have been hit in the United States have been massive. And so there'll be massive disasters. And even when the disasters are not massive in the sense of one big hit from like a hurricane or something like that, the disasters have been on the side of tornado after tornado. We have more tornadoes this year than last year. And then added to that, we have the different storms that had hit America or various different American areas. So when these things happen, if you notice, like in Puerto Rico or places like Houston, the Keys in Florida, you're left without basic services. So it is important for you to be able to contemplate or consider what is it you're going to do to prepare yourself when something like this happens. Because as the funding cuts continue, which it seems like we're in another round of funding cuts where the money is more, instead of being put in place to take care of disaster, the money is being put in place to basically give more tax to the rich so they can have more business and make more money. So as this happened, you have to say, well, if you can scrape off a little $5 here, $20 here, and put together your health kit, put together your go bag, do that type of stuff. Don't say, well, the government will take care of you, because that becoming obvious that there is that reality. So notice here, that's not me saying no. I'm just taking the words of the professionals. They say the accomplishment achieved in improving public health and preparedness for all hazards have been undermined due to severe budget cuts and lack of prioritization. So this has been constantly undermined. And the type of things we're talking about here is a pandemic. That means there's something spreading violent and you can't really avoid it as you move around. Severe weather and even attack, a terrorist attack or an attack from some enemy. So you have to be prepared for this. And if you look at this, it's like they're, as it says in the last paragraph there, that they're reacting to these things. Instead of saying, well, they're going to happen, let's just put aside a certain amount of money each year. They're waiting for the thing to happen. And then they say, well, let's declare. And as they declare now, they have to start, as the article said here, they have to start. They often need additional funds. So you see the disasters last year, you see the disasters the year before, you see the disasters this year. So then you just say, I'm going to put aside money for this because this is just coming, whether or not we like it or not. And it's the same thing in our personal life. You put aside money for things that you know is going to come. So in other words, just in case you say, what am I getting at? I'm saying just make it a part of your budget that this is the disaster money. Stuff is going to happen bad. And just leave it at that. And you're going to find that you could finish the year and you didn't use the money. Well, just roll it into next year. This is your money that in case something catastrophic happened around me, I'm prepared for it. Now, how would that work when it comes on to a pandemic like a MERS, a flu, a swine flu, anything like that, any influenza? It's that normally when you're getting sick, you find that you burn a lot of money on trying to buy some remedies, trying to do something to be able to get yourself better. So you start spending some of the money up front, and then some of the money you keep so that if you have to go buy more natural remedies, buy more things to build your immune system, do what you have to do, then you go ahead and do this. Other than that, it will be okay to have some mask on you, so have a little bag where you have mask. So if there's a outbreak, you don't have to rush out to the store and then, oh, there's no mask. If you remember in California, the fires were burning and they had to run out of mask, and they ran out of mask. There was just not enough mask for everyone. And so it's always good. I always believe it's good to have masks, especially if you live in somewhere where it's industrialized. Then having an ear mask for breathing is important, so you can cover your face and still breathe, because just in case there's some type of chemical spill, something like that. But other than that, depends on the area you live in, so forth. And if there's an outbreak, you want to have a good mask on you, something that's decent that will basically be able to make you go into public, breathe, and not catch some type of influenza. And then you have to try to not get it out of your system. I'm for one to believe in prevention is better than trying to fix the problem after you get it. Other things also is to have some immune herbs always on you, have some treatment methods, what you're going to do if you pick up some lung problem, some throat problem, some type of virus, how you're going to treat it. learn these natural remedies, just learn the natural remedies, learn the things to do, and basically be prepared to do them, and also have some things on you, especially when we come into the flu season. Or, as I say, if you hear of any increase in the amount of flu going around. This year, I've only seen one news article that is indicating that the flu season started off a little bit stronger than normal, but I haven't heard anything else. So I'm always looking out for that, because I'm always like, hey, let's see what's going on. Because if I start hearing rumbling, or if I'm talking to people and they tell me on the street, they tell me just, not in the news, but just in general, oh yeah, there's more people catching the flu this year, then I just like, okay, I need to start beefing up on my onions, garlic, herbal remedies, anything to do with boosting my immune system, more vitamin C type products. So basically, I'll always have on hand and then stock up on it if I know just your regular orange, lime, lemon, grapefruit, that type of thing. But I'll get the lime, lemon in the bottle already juiced and, stored away. So you have that stuff so you can start fighting. Know your weaknesses and know what's going on. And be prepared, and don't be afraid to say, I'm going to put aside some money because if something goes on, I'm going to have to start fighting this. Get air filters for your house and other means that are out there on the market to be able to purify the air, purify the water, and that type of thing. So anyhow, so just word of advice, as I say, as they're doing the spending cuts, be prepared to do something for yourself that somebody else is not going to do for you. And look at what happened in Puerto Rico. Yeah, the help came, but if they were more prepared to help themselves and have certain things in store and in place, when a disaster like that strike, you would be more self-sufficient. And if you're in an area like that and a disaster strike, at least if you're prepared to ride it out for a month, 2 weeks, a month, month and a half, you'll be better than most people, because by the time the help come, well, you'll be all right because you are prepared for it. So, disaster preparedness is something of our reality. It's just something of the reality that we deal with. And don't be afraid to say, hey, look, people might say it's alarmist, but, let them continue with their blindness. You just say, hey, look, I'm going to do some preparedness in case something happened, because if it happened, I'm prepared for it and I'll do better. And that to me is the difference between the righteous and the foolish. The foolish, they're like, not worried about it. So they're not prepared for anything. And if there's any delay, anything that happen, they get caught out there. But that's the whole idea. In your life, you must experience the difference of following Christ. You can't be like everybody else and say, I'm following Christ. And what's unique? What advantage do you have? Now that the article I'm going to share here is a quick little article here on exercise. And I think it's important just to know this so that you can share this with those you love. And it's entitled, again, this was written last week. This was on various exercise can slow Parkinson's. And so I thought this was interesting to show the power of exercise. Written again by Maggie Fox. And it says here, Jeffrey Rogers knew he felt better after hitting the treadmill. When I would finish one of the session, there would be a calmness. The tremor would be calm, says Rogers, a 69-year-old Parkinson patient. Rogers was part of a study released Monday that showed intense exercise can slow the progression of Parkinson's enough so patients can notice the difference. It's the latest study to show that exercise benefits patients with Parkinson's. And in this study, shows that patients shouldn't be shy about pushing themselves and getting sweaty. In fact, the harder they pushed, the better they did. The team reported in the Journal of American Medical Association, JAMA Neurology. We gave them a proper workout, says Daniel Korskos, a professor of physical therapy at Northwestern University Feinberg School of Medicine, who helped lead the study. If you have Parkinson's disease and you want to delay the progress of your symptoms, you should exercise 3 times a week with your heart rate between 80 to 85% maximum. It is that simple. Rogers pushed himself for 4 to 6 times a week as part of the study, cranking up the incline on his home treadmill and walking hard. Afterwards, the tremor that is one of the hallmarks of Parkinson would subside for a while, he said. It might last 20 minutes or more. It's not a cure, it's a way to manage the symptoms, Roger told NBC News. It's clear that exercise is good for Parkinson's patients, says Dr. Lisa Shulman, who does her own experiments on exercise and Parkinson at the University of Maryland School of Medicine. The evidence is really very strong at this point. There is sufficient evidence now to warrant a general recommendation, said Shulman, who was not involved in the study. Parkinson's symptoms include tremor, rigid muscle, and problem with movement. While early treatment can delay the worst symptoms, people almost always get worse. About 60,000 people in America, 60,000 Americans are diagnosed with Parkinson's disease each year, and about 1 million Americans have Parkinson's now. No medical therapy can cure Parkinson, and while exercise was always shown to help people feel better, it was not generally accepted as a true therapy until recently. Now, teams are trying to find out how much exercise help and just which symptom it affect. Doctors say they've been thrilled just to slow the inevitable worsening of the disease. If they can freeze progression or reverse symptoms, that would be a home run. Corcus, the colleague says that Corcus and colleagues said the most intense exercise appears to have the least temporary frozen symptoms in many of their volunteers. The earlier in the disease you intervene, the more likely it is you can prevent the progression of the disease, Corcus said in a statement. We delay worsening of symptoms for 6 months, he added. Whether we can prevent progression any longer than 6 months will require further study. They worked with 120 patients with early stage Parkinson. They randomly assigned them to either moderate exercise 4 days a week, intense exercise 4 days a week, or no additional exercise. It's important to randomly assign people because it's possible people who voluntarily exercise more or harder also have different symptoms and less severe disease. The vigorous exercise group were pushed on a treadmill, with the researchers increasing speed and incline until the volunteers were at 80 to 85% of their aerobic capacity, meaning they were breathing hard and probably sweating. Roger was assigned to this group. This is not mild stretching. This is high intensity, Corcus said. They were trained at the hospital and then sent home to exercise as part of their daily lives, and asked to send their data to the researchers. The moderate group were pushed 60 to 65% of capacity, which feels like exercise but does not get the heart pumping as hard. Maximum heart rate is based on age, and there is a formula for calculating exertion. An estimate of a person's maximum age-related heart rate can be obtained by subtracting the person's age from 220. The Center of Disease Control and Prevention says the maximum heart rate of a 50-year-old person is 170 beats per minute. So 80% of that is 136 beats per minute, and 60% is 102 beats per minute, right? So I think that's a good keeper there to keep in mind. So for some people, a brisk walk get them to 80% level, while others may need to be running or walking up a steep incline. So before I wrap up this article, I want to So give you that information again, because this information is good for you to have personally, as a person who wants to be healthier, and it's good for you to have to share to others. So what they're saying is, a rigorous exercise is 80% of your maximum heart rate. So your maximum heart rate, they calculated by however matrix they come to this, but this is the Center for Disease Control and Prevention. So I'm gonna take it that I'm taking their advice and I'm sharing it with you, so you can go by their advice. Remember, I'm just passing this on, but I'm using this even for myself because I think it must make sense. The maximum heart rate of a 50-year-old person is 170 beats, because you're taking away 50, which is their age, from 220. So 220 is the number somehow that they come to after they research with various different people. And they say if you take the person's age from 220, you get their maximum heart rate. So the heart should be beating at that age. At a 50-year-old person, the heart, I guess, going flat out would be 170 beats per minute. So they want to take the person up to an exercise of 80% of that, which is calculated at 136 beats per minute. Or if it was 60%, it would be 102, which wouldn't be anything much. So why I thought this is important to share, because imagine if a person, you always wanted to find a quick method to give to a person, because see, say if you deal with a person, or I'm dealing with a person is, say, overweight and they need to exercise, probably going 3, 2.5, whatever that is, pace on the treadmill would be really a real heavy workout. So they do that for, say, for half an hour. That's a heavy workout. Probably 10 minutes would be a heavy workout, depending on the person's weight. So there has to be a way to calculate, because then the weight variable, or the idea of how fit the person is variable, would not affect this math, in my understanding, unless the person is like, incapacitated, and coming out of bed would make them have, their maximum heart rate. So causing them to sweat, or eating some food will cause them to sweat. But for the most person on the spectrum of close to sick to healthy, the healthier or the fitter you are, it takes more for you to really build up to your maximum. More rigorous person who is less fit, more unhealthy, will take them less. So I always did, which is a quick way to do it. So I like this methodology, because this methodology just basically say, person is 50, 170 would be their maximum heart rate. Take them up to 136. So whatever walk it would take to take 136, even if they're overweight or they're very fit, that's maximum. Push to 85, you're up to about 140 something. That's great. And the person is really going there sweating, and whatever it is, the fitter the person are, it's a bit harder for them to get up to that level. I think that's reasonable. Some people push harder, but I think that's reasonable. If you could do this type of exercise where you're 80%, or 85% of your maximum, and you're walking, jogging, running, doing whatever, either 3 to 4 times a week consistently for 6 months, 3 to 6 months, your results and your gains would be quite impressive. You'll be quite good, especially if you have a healthy diet. It'll be quite good. So I think this is very good, period. That's why I wanted to read this, because I think this is a nice little piece of advice here that is a keeper for you just to have. So that means if you have something on you, like some of those watches, or you have one of those phones, and you say if your capacity is higher than that you can go to 90, 95. I don't know if that's great for you to flat out for half an hour at 95, because I really believe as if you don't overdo it, but you really get to a point where you're having serious exertion and you're sweating without trying to flat out yourself, what will happen is that you can consistently exercise regular, long term. Normally you go flat out, what it is, you tear more muscle, and you need more time for recovery. And so that's not good for consistent exercise. So it's just this year great for anyone. I don't care if you're into you want to really, be the next, health star or whatever. You just want person just want to be fit. This is great advice. So, for some people, a brisk walk will get them to 80% level, while others may need to be running or walking up steep incline. It depends on the person, but the numbers I think is good. The team also assigned people to exercise 4 days a week with the hope they could actually do it 3 days a week for 6 months. They did indeed get about 3 days of week of exercise in both groups. To determine if patients got better or worse, the researchers used the Unified Parkinson Disease rating scale. The volunteers were on average at about 20 on the scale, which measure 31 different areas of mood, activity level, and motor skills. Patients scored from 0 to 4 on each, and thus the most severe possible score is 124. After 6 months, those in the high intensity group were still at about 20 on average. I was not getting worse. I was not deteriorating during that period of time, says Roger, who also did not take any medication during the experiment. You could feel it. Those moderate exercise worsened very slightly by about 1.3 point on an average, which in any single person would not be noticeable worse. Those who did not exercise worsened by 3 points on average, which is enough for someone to notice, says Schulman. So this is another important part of the presentation that you need to just kind of keen on. The intensity workout group, they were off their medication, so no medication for 6 months. And after 6 months of exercising at least 3 times a week, they did not progress. The disease was stopped. They just stayed at 20. So 6 months, 3 times a week, their disease did not get any worse. It just basically stopped the disease in the track on no medication. So no medication, just exercise. The disease did not get any worse. It did not say they changed their diet. It did not say they do any other things you could do naturally to try to stop the disease. So this is actually very good hope, because if you could have just an activity of doing 80% of your heart rate workout for 3 times a week, and if you could do that and you have a disease that even if it doesn't get any better, it doesn't get any worse after 6 months, that's significant. While the other group that exercised moderately, they had an increase, they increased by 1.5, but still not noticeable. But it tells you again that exercise benefits. But the group after 6 months that did no exercise, they had increased to 3, and you could note it. They said they could note the difference. It was noticeable that they got worse after 6 months. So that's a bravo for exercise, and that's something that we just need to do for all disease, because I think this can be applied to just about any disease. You take somebody having coronary artery problems, exercise 3 days a week, 80% of your heart rate, it will stop the disease, or even start reversing it. If you have a person like I covered 2 weeks ago that has diabetes, who just start losing weight, and he lose within a few months 40 pounds, and he got off his diabetic medication, that's just the potency of dietary change, but that's again is a potency of exercise. So again, a person that's really in a bad shape, as I say, unless the doctor says zero exercise, just dietary change, well, we have the solutions for that. But if you can do the exercise, your doctor say, yeah, you can do exercise. You go 60, say, if even the person, well, I can't go 80% of my heart rate, then do 60, because you notice the group that did 60, the disease progressed less. So for 3 months, do 60. And after 3 months, exercising 3 to 4 times a week, you do 60. Then you knock that up to 80% of your heart rate after that 3 months, and you start getting the gains. And if you add to that diet, exercise, a lifestyle that is stress-free, stress reduction, then God will bless you. So Schulman did a similar experiment. She found that no matter how intense the exercise, almost all patients who exercise were later able to walk faster. This was counter to our hypothesis. We thought the higher intensity group would improve the most, she said. So this again is something that is interesting, because it's not just the shaking, but it's the ability to walk, because it's a neurological disease, Parkinson, with what we're talking about here. And so the Parkinson disease is going to affect the person walking, more essentially exercising, like walking and doing other exercise. You're basically stimulating the whole body. What she found out in her set of exercise that she did separately is that you increase the person's ability to walk faster. That's significant, because that is now to me more a sign of reversal, if you understand what I'm saying. If 6 months later you're able to walk better and faster, say, I'm just using her words, she said faster, and that's it, well, great. That's why we need to do this. And you're going to tell me again, you name the disease the person have, and they start exercising like this, they're going to be able to do everything better. And so Shulman and Corcus agree. Exercise isn't just a feel-good thing that Parkinson's patient can do as a complementary activity. It's actually medical treatment. We are stopping people from getting worse, which is significant, particularly if we catch them early in the disease. Corcus said, it's part of the idea that exercise is medicine. Roger, who owns a construction business, which is Roger's the person that we started out with in the article, says he failed to keep up with the exercise program when the study ended 4 years ago, and his Parkinson's has worsened since. So here's this person who has a construction business, and he basically fall off the exercise program, and his Parkinson's have gotten worse. So while he was on the exercise program, exercising 3 to 4 days a week, and taking his heart rate up to 80% of his capacity, his Parkinson has stopped progressing. He came off the exercise, a Parkinson stopped. So here, exercise become your medicine, and the medicine works. The medicine has been clinically proven to work in experiment for Parkinson. So if you're saying to a person, so somebody say, I'm sick with this thing, and you said to them, yeah, you need to exercise. They say, oh yeah, I know that. No, you don't know that. You need to go to your doctor and let them write a prescription for you to exercise, if that's what it takes. Because again, if it's not a prescription, or if it's not listed on a prescription, then it's not medicine. Well, here they're saying exercise is medicine. Let me read it again for you. This is a quotation. It's part of the idea that exercise is medicine. This is again from Corcus. This is a doctor. He's saying it's medicine. So you think about aspirin, when you think about all these various different type of drugs that you have out there, exercise is one of those drugs, basically, the doctor is saying here. Rogers, it says the tremor is more intense. Rogers says it happens more often, and he has no idea if the symptoms would have worsened had he continued to exercise at the same level as he did during the 6-month-long study. But it was so hard to work and exercise that much too, he said. It was too much. I was going to slow down. I am going to slow down, which will free up some time for working out more. So he says his difficulty was running his construction business and exercising. And I can understand, because when you exercise, you need time to repair. Sleep and exercise go hand in hand. If you exercise, you need to sleep, because you need to repair. And so your body need a repair. So if you get the repair, it's good. So with that, I'm going to go straight into my next article. So again, as I say, exercise is medicine. Get your medicine and get some today. It'll be good for you. If you don't get some today, get some tomorrow, but get it at least 3 to 4 times a week. So the next article I'm going to share with you, which is the main thing I wanted to talk about, but it seemed like I'm going to have to talk fast over this one. And it's entitled FDA to Crack Down on Snake Oil Homeopathy. It's again written by Maggie Fox. Little Blaine Talbot started teething especially early, when he was just 2 months old. His mom, Karina, was looking for something gentle and harmless to help ease his distress. And when she saw homeopathic teething tablets in the store, she grabbed them. It said homeopathic, all natural, organic stuff. and so you think that stuff is going to be safe for your child, said Talbot, a full-time homemaker in Colorado Springs. But soon Blaine was suffering seizures. Neurologists could not explain them. But when she ran out of the homeopathic tablets, the seizures stopped. But Karina Talbot had been given her baby Highlands homeopathic teething tablet, which the Food and Drug Administration had since asked people to stop using. The tablet often contained harmful levels of belladonna, a plant-based poison. Belladonna is a plant-based poison. So now here, I'm sure you've been in the health food store. If you've been in the health food store, you've seen the Highland brands. It's probably one of the most recognizable brand of homeopathic remedy, but there's many other brands. So they, I guess, would have the market interested that their name is here because they would have the market. So I was petrified. I mean, my child, 2 months old, and you really don't think that something like this is going to happen to your kid. Now, the FDA says it's going to take a tougher approach to the $3 billion a year homeopathic market. While the FDA always could regulate homeopathic product as drug, it has not been generally doing so. Now it will to some degree. People may be putting their trust and money in therapies that bring little to no benefit combating their ailments, or worse, in products that may cause serious and even irreparable harm. The FDA Commissioner Scott Gottlieb told reporters in a telephone briefing. The agency won't immediately regulate all homeopathic products, but will start acting against companies that make products that could cause harm. It already does act against products shown to have caused harm. The issuance of this guidance have finalized is intended to provide notice that any product labeled as homeopathic that is being marketed illegally is subjected to FDA enforcement at any time, the proposal guidance read. So basically, they say they can just come in and start to, deal with the product and confiscate and do what they have to do, or do a recall. The FDA has been working on the issue since 2015 when it held a hearing and asked whether it should regulate homeopathic products more closely. The focus will be on treatment that are sold for serious conditions that do not appear to have any actual benefits. It's also covers situation where product labeled as homeopathic contain potential harmful ingredient or do not meet good manufacturing practices. The FDA says there is no scientific basis for homeopathy. There is little evidence to support homeopathy as an effective treatment for any specific condition. The National Center for Complementary and Integrative Health, one of the National Institute of Health, says in a statement, several key concepts of homeopathy are inconsistent with fundamental concepts of chemistry and physics. Homeopathy dates back to the 18th century when medical science were pretty basic. We didn't have much to offer. We had quinine for malaria. We had willow bark, which basically contained aspirin, but not much else, says Dr. Paul Offit, who had vaccine education at the Children's Hospital of Philadelphia. Offit writes about homeopathy in his book, Do You Believe the Magic? Is a question mark, and that's the name of the book, The Sense and Nonsense of Alternative Medicine. So that's his book right there. Homeopathy was meant as an alternative to bleeding and purging patients. The idea is that if substance is diluted in water, the water will somehow remember that the compound was there. This approach was used to make potentially harmful products safe enough to use. Right? So what I'm going to do here, I'm just going to read. That's the way they describe it in the article. So I'm going to pause reading the article here. I'm going to read a quick description of what homeopathy is. Just a quick description, nothing in detail. So just in case you can read more about what is homeopathy. So it's HOMEOPATHY. So you can read about that on your own and understand the methodology. So this is from, this definition here comes from Merriam-Webster.com. Simply, homeopathy is a system of medical practice that treats a disease, especially by administration of minute doses of a remedy that would, in larger amounts, produce a healthy person symptoms similar to those of the disease. So produce in a healthy person symptoms similar to those of the disease. So homeopathy basically will take a minute dosage of a poison, give it to a person, and to trigger similar reaction that in a healthy person that is similar to the symptoms of a disease. So that's what homeopathy is. So read again what they describe it in the article. It's a similar description, but I just wanted to read it just to broaden your thinking. And then we're going to talk briefly, because we're out of time, about homeopathy. So homeopathy was meant as an alternative, back to the article, to bleeding and purging. The idea is that if a substance is diluted in water, the water will somehow remember that the compound was there. This approach was used to make potentially harmful products safe enough to use. So basically, you're just diluting a poison. So like a homeopathic remedy, say for irritation of the eye, would have bee sting in there. So bee sting, if you get a full dosage in your eye, would cause a severe reaction. So they water it down to a very low degree. And so when it gets into your eye, it will cause a minor irritation. In this irritation, the immune system will jump into action to fight, because it's forcing the immune system to act, to fight, to clear the eye out. And then they will say, well, the immune system will clear the eye out, and you fix whatever irritation you had before you put the bee sting in your eye. Well, it's not bee sting, but it's diluted bee sting with other natural remedies. So that's the kind of concept. They give you a low dosage of the poison with the hope that the body will react. Well, it is no different from, say, vaccination. Vaccination is in a similar concept. These things came about the same time period. So back to the article here again. So you think about that. Oh, so if you ask me, just because we're running out of time and I want to say this. So I'm for one, is not a believer, never was, in homeopathy. I don't believe it's good to give people even low dosage of poison. Now, I've tested homeopathic products, not per se with faith or without faith, just basically testing different products for different reasons. And you will get results. But I'm still not sure if the results you're getting is because of the other natural remedies within the product, or because of the ability of the body to fight. And is this the best way to get the body to clear out poison by adding a little dosage of poison to kind of force the system to fight? I believe there's other methodologies. So that's why I don't use homeopathic remedies. So I'm just saying that for just you to know, buyer be aware. So more than 200 years later, there are drugs, vaccines, and surgical procedures proven to work safely, yet homeopathy persists. So this is what the article is saying. This is their mindset. At its most benign, homeopathy is basically what it is diluted in, which is water. So the harm is you use the homeopathic product instead of something that can help you. But sometimes the product are contaminated, like the Island's Teton tablet were. Offit says it's understandable that many people believe in homeopathy. We want to believe in something that isn't harmful, like pharmaceutical products, and here is a nicer, gentler way to relieve pain, your stress, etc. It's fanciful. We want to believe it. We want to believe that these are just people who care about us. These are just helps or old hippies making their products in a flowery meadow. Probably they are making it a flowery meadow. The homeopathy industry has fought hard against the FDA regulations last January, when the FDA asked Highland to warn its customer to throw away any unused bottle of the belladonna tainted Teton tablet. The company resisted but has since relented. As you may remember, the company discontinued the manufacture and sale of these same products in October 2016. As part of the recall, consumers should discard any Teton product that they may have. The website now says, at least Highland website now says. A year ago, the Federal Trade Commission said it would require makers of homeopathic drugs to provide scientific evidence for health-related claims. I'm sure the industry will push back, Offit said. These are snake oil salesmen who have been getting away with it for far too long. So that's what he says. The FDA said it was planning to rescind in 1988 guidance document in which it allows homeopathy to bypass the federal approval process so long as they follow good manufacturing practice, labeled the ingredients clearly, and followed their guidance. In other words, it suggests that these products could be marketed without FDA review and approval. In other words, what they're saying here about clearly, if you ever think about homeopathic remedy, it just said things like IPIX 6X, Xanax 510X. It's just like that they label it. So you can't, like, when you go into the store to buy the product, you just says this product is good for this. And then you flip it, read the ingredients list. It just tells you 5X and 6X and some Latin names. And so you really don't know what it is. You just basically go home, take it, and you know exactly what it is. And then you have to really go home, Google, find out what exactly is 6X, 5X, and 10X, and what are the other Latin names that they have in there, or whatever names they have in there, whatever scientific names. And then you find out what it is, and you say, oh, so that's B thing they're selling me. Interesting. So that's one thing. The other thing also is that it's the same thing when you take a prescription pad. The doctor says, well, take this prescription for this, and everything will be good. And then they write some stuff down in scribbles, or write some Latin name, and you go home, or some makeup name. And you take it, and then you say, well, let's Google this. You Google it, and you find the same thing. It has all kind of crazy side effect. If you take it, your arm is going to fall off, and your head is going to blow up. And so one group is saying the other group is a snake or a salesman, but the other group is the mainline group. So you're gonna have to take this type of stuff with a grain of salt. But for me, I don't believe still in homeopathy. So because I got time, I'll stop right there with the article. So later on, the young lady had stopped using on the child, and the child is doing, I think it's doing fine. And so they basically wanted them to pull some of their products because they have products with similar ingredients to strychnine and stuff like that. So really, this is an old world idea that we don't believe in. That we don't believe that you take low dosage of poison. Even that poison is from a major manufacturing company that has labs all over the country and they're FDA approved. We believe that drugs are poison. You take it and you might get some benefits, but the benefits are a lie, and it will kill you long term. And so find natural remedies, find other solutions for your sickness. God will bless you in your search, but just be open to taking stuff that are from the tree of life, not from the tree of the knowledge of good and evil. And you'll find that you will have a better experience in your health than if you partake of things that are trying to poison you in order to fix you, because they say most drugs is you poison the disease. It's the normal concept even of all cancer drugs is poison the cancer, but while it's poison the cancer, it's poison you. And if you live there, say, well, you're in remission, you did good, but if you die, say, well, oh well, you got killed by the drugs, but this is part of the, you weigh the pros and the cons, and you got the cons and you're dead. Find some natural remedies and God will bless you. Let us pray. Our Father who art in heaven, we thank you, dear Lord, for the options you give us, the wisdom you give us, and the guideline you give us, dear Lord, to be healthier and happier people. May you bless us as we go through the rest of this day. And thank you again for your wisdom from on high. This is our prayer in Jesus' name. Amen. Thanks again for being with me here on Revive Reform Radio. Looking forward to talking to you tomorrow morning where we should talk about current events. Until then, I pray that you may continue to walk with the King.